What environmental triggers affect seronegative Ra? Imagine trying to solve a puzzle where some pieces are missing. That's similar to understanding what environmental factors influence seronegative rheumatoid arthritis. And like other forms, seronegative Ra doesn't show the typical blood markers like rheumatoid factor or N-tusutrelenotide protein antibodies. So, researchers are still piecing together what environmental triggers might play a role. One of the most studied factors is smoking. It's well known that smoking increases the risk of rheumatoid arthritis overall. It can cause immune changes in the lungs that may lead to joint inflammation. While smoking is most strongly linked to seropositive Ra, studies suggest it might also have a smaller effect on seronegative cases. Smoking can influence how severe the disease becomes and how well patients respond to treatment, making it an important factor to consider. Beyond smoking, other airborne irritants like silica dust from certain occupations have been linked to rheumatoid arthritis. These exposures can activate the immune system and cause inflammation, which might contribute to the development of seronegative Ra, although the evidence isn't as strong as it is for smoking. Geographic location and socioeconomic status also seem to influence Ra risk. Different regions and communities have varying rates of Ra, possibly due to differences in lifestyle, infections, or environmental exposures. For example, some studies suggest that birth-related factors like birth weight and early life environment might indirectly affect the risk, although more research is needed. Hormonal and dietary factors are also under investigation. Reproductive history and hormone use may influence immune responses, but their specific impact on seronegative Ra isn't fully understood yet. Diets rich in certain nutrients or anti-inflammatory foods could potentially modulate immune activity, but clear links are still being studied. It's important to remember that gene-environment interactions are complex. While certain genes increase susceptibility, environmental triggers like smoking or occupational exposures may activate disease pathways. For seronegative Ra, these interactions are less well defined, which suggests that environmental factors may influence disease development through different mechanisms compared to seropositive Ra. In summary, environmental triggers for seronegative Ra include smoking and airborne exposures like silica dust, as well as geographic and socioeconomic factors. Hormonal and dietary influences might also play a role, but research is ongoing. It's crucial to understand that no single factor causes Ra alone. Instead, a combination of genetics and environment over time contributes to disease onset. If you suspect environmental factors are affecting your health, consult with a healthcare professional for personalized advice. Remember, managing environmental risks is just one part of a comprehensive approach to rheumatoid arthritis care.